Hi, this is Jester, and I am doing this video for Com3 at the University of the Philippines, Open University. We will be interviewing today a nurse, and let's see how and what's the other side of being a nurse. What's the experience of being a nurse? So, hi.
Hi,
So, what's your name again?
my name is Kat.
Okay. So, Kat, in what hospital do you work?
Right now, I'm working in a government hospital. It's in Rizal. It's Rizal Provincial Hospital,
Okay.
Annex 2. Yes.
So, that's in along Antipolo?
Yes, along Antipolo, near
Near.
Shopwise.
Okay. So, in what particular branch are you assigned?
I am assigned in nursery or neonatal intensive care unit.
Okay. So, basically, you are uh, caring for babies, right? Nursery.
Yes, I am caring for newborn babies, the
Okay.
infants.
So, what are your experiences about caring for babies?
Um, we have different experience. My co-nurses and I, we're dealing with different cases
Okay.
because newborn babies have different situation. Like some babies are not having reaction or they are not well flexed. It means that they're not moving.
Okay.
The pulse is not 100 and above. So we have it's a very complex job. Actually, in nursing or in the hospital, we call it special area. The NICU, operating room, and delivery room. That's the special areas.
Okay, so have you worked on other areas aside from NICU or the nursery?
Yes.
Okay.
The first time I entered the government hospital, I was assigned in OB ward for 1 year.
Okay, so was this the hospital you are working in right now?
No, that's the Annex 1. So
Okay.
that's the main hospital.
So Annex 1 is located at...
Annex 1 is located in Cogyo,
Oh, okay.
Antipolo.
Okay, so as you said earlier, what are some cases
Mm-hmm.
that prevails in nursing care?
Actually, in nursing care, we have different um, areas or specialties. We have geriatrics or the 60 years old and above. We
Okay.
have neonates, the newborns. We also have surgery ward and the OB cases, the postpartum or the new mothers.
So, when you are, suppose I am your director and I will give you a choice, what branch will you want to be assigned?
I think I would prefer the special areas like delivery room
Okay.
and NICU or nursery because it's not just because it will give me more opportunities abroad because it's a special area,
Oh,
but
okay.
I'm enjoying the job itself because I wanted to the situation we're in. It's between life and death. You know,
Oh, okay.
your adrenaline rush is high.
Okay. So, since we are talking about special areas and being a patient myself, I only know that there are wards. So, are wards not a special area?
Actually, no.
Okay.
We don't consider ward as a special area.
Okay.
Special area is we call it complex, or the operating room, delivery room, and NICU or ICU.
So, as you said earlier, there is a life and death situation. So,
Mhm.
have you experienced a life and death situation in your job?
Yeah, many times inside the complex or in operating room and
Okay.
delivery room. Um, Patients are monitored um, every 15 minutes or 20 minutes or 30, depending on the doctor's order, because we have to check their vital signs if they're stable after the operation or
Okay.
after the delivery, pre or post delivery.
So, when you say pre, that is
That is
before.
yeah, before,
Yeah, and the post
and then
is
that after the
after.
delivery or the operation.
Okay, since we are talking about life and death, so what is the most significant, case that you handled?
Um, right now in Annex 2, because
Okay.
actually I have handled many cases.
Okay.
Um, but right now, the very recent one is just earlier. Because the baby wasn't able to make it. He was born yesterday in the afternoon. He was intubated. It means that he cannot breathe in his own. So
So
we
there are
are
hosts that
yeah,
you've
there's a
inserted in?
hose
Okay.
inserted in his mouth through the lungs. So we
Okay.
call it ET tube or endotracheal tube. It's
Okay.
connected in a ambo bag. So the patients the relatives are continuously bagging or giving oxygen to the
So
baby.
I have a question. So when the ET tube is
Mhm.
inserted, uh, does that matter if the pump is manually or in an automatic respirator?
Okay. If we don't have mechanical ventilator, or
Okay.
we call it mechanical ventilator, if it's not available, you can do it manually. But in cases like, if it will be if the patient is needed to be intubated, or we call it, yeah, in the tracheal tube for almost
Okay.
a month or two. So we need to have that mechanical ventilator, because it's very tiring if you do it like for 24
So
hours.
so a patient can be intubated for at least a month or
Yeah.
yeah. So how long does intubation can prolong in a baby?
Mm,
In 6 months or
in It depends.
okay.
Right now we have a baby who is intubated for 13 days already. Right now he's in day 13, and he's still alive right
Okay.
now, but he had cardiac arrest earlier, and I was able to revive the doctor, and I was able to revive his heart. So we give
So
medication for the heart to pump again,
okay.
to beat
So
again.
uh, when reviving a baby and you are administering as a nurse, what can you feel?
Um, for me, I love babies and children, so I have to control my feeling, because
Okay.
like what happened earlier, the parents was there, mother and the father, and all the relatives
They
was
are
there.
beside
Yeah,
the bed.
no, no, just outside, but
Oh, okay.
because we cannot
Uh,
allow people to enter.
so you are in the ICU, right?
Yeah,
Okay.
so
They're
just the
watching outside.
parents.
Okay.
Mm-hmm. They were watching while the doctor is explaining to them that the condition of the baby is not okay.
Okay.
So we keep on doing CPR for almost an hour, and we're giving medications for the heart to beat again, but he wasn't able to make it.
Okay. So wow. I'm quite shocked about the informations I received right now. So yeah, I think that in my own opinion, uh, it's it's life, and you know we have to value life up to
Yeah.
its fullest, right? So thank you for
You're
the interview,
welcome. Okay. Thank you.
and I hope that your job will save lives, more lives.
Yeah.
Bye.